Dr. Hira, how important is it to be aware of cancers that could be aggressive like breast cancer? What are the common risk factors as far as Pakistani women are concerned, and the early signs and symptoms that you could maybe detect yourself and then go to doctors such as yourself? What kind of screening recommendations also would you like to recommend to women in the early stages? I just want to have a summarized introduction to all of this.
Thank you, Umar, for inviting me. Basically, breast cancer is one of the most common cancer in the world, and it is the major cause of death in women all over the world as well as in Pakistan. So it is very important for women to know that why does it happen, what are the basic signs and symptoms that the women can have with respect to this cancer, and what are the treatment options available with us. So basically, with time we see that the cancer incidence is rising, and because of the various reasons, including environmental factors and lifestyle indications. But one thing I want to mention here, that being a female is itself a risk factor. This is a female disease. This is a female related health problem. So if you are a female, you are at a risk of breast cancer. Then there are other factors, like for women who have never had children, who had their periods at a very young age, and who didn't breastfeed, who became never pregnant, and who had treatments for infertility, who had hormone replacement therapy for a long time, who had use of oral contraceptive pills for a long time, or women who for that matter, who had been very inactive, had a sedentary lifestyles, and all these women, they are at high risk of breast cancer. So obesity is one of the major causes of different cancers. Similarly, it is one of the major cause of breast cancer as well, which is often neglected in our country. So on average, the BMI in our country for women is between 30 to 35, which should ideally be 20 to 25.
Right.
So it is one of the major factors our women are getting these cancers. So in addition to that, we have no physical activity, our environment is polluted, we have different chemicals which we inhale because of our polluted environment. Then we have different food contaminations, our water is not clean, our foods have various preservatives, and with time our intake of different foods which are more preserved and packaged is increased. So all these factors combined, they are posing at an increased risk of breast cancer. So in addition to that, I want to tell you that yes, we are at risk of breast cancer, but one should be aware of what are the major signs and symptoms so that we can detect it early. As we know that it is so common that every 1 in 8 or 9 women will have breast cancer in their life. So if this is so common, then any one of us can have it. So we should be aware of the basic signs and symptoms that one can have, which may include a slight changes in the breast, which can be just minor changes, including inversion of the nipple, like if there is any skin redness, or if one side of the one breast is heavier than the other breast, or the size of one breast is larger than the other breasts, and it has started enlarging suddenly. And if you feel a lump in the breast, so lump means that if you feel that one part of the breast is harder than the rest of the breast or the other breast, then that is a feeling of a lump. So if you see any skin changes or nipple changes, including redness, and if there is a discharge from the nipple, all these can be early signs and symptoms of breast cancer.
Right.
Similarly, any lump in the axilla or near the collarbone, which means that in the lower part of the neck, if anybody has a lump near the collarbone or the lower part of the neck, that can be a sign of breast cancer as well. So if you have any of these signs or symptoms, we have to go to the doctor and get ourselves examined. The doctor will evaluate and will confirm those changes and will advise you an age appropriate test. Like for example, if somebody who comes to us with a lump at the age of 45 years, we will recommend a mammogram, or if somebody comes to us at an age like 35, we will recommend an ultrasound. So there is an age appropriate test for every woman if they have any changes in the breast. So once the doctor confirms on examination and then the age appropriate imaging, then they advise biopsy. That is the confirmatory test that confirms breast cancer. So, so this is how the breast cancer is diagnosed, and these are the basic signs and symptoms that the women should know that if they
and
have.
And of course,
this
is how they also need to be screened. You said the screening is also age specific, the kind of screening.
Yeah, so screening is basically a test that is done in normal women. Like we talked about the women who have signs and symptoms, who did their examination, had signs and symptoms, and they have come to a doctor, and the doctor has examined them and confirmed them. Screening is basically a simple breast X-ray. Screening is a test that is basically recommended for women who are above 40 years of age. And this test, the beauty of this test is that it detects breast cancer at a precancerous stage or at a very, very early stage before even the lump is formed.
All right.
So every woman who is 40 years of age should get a mammogram done. And
every
then,
couple of months, basically.
Yes. No. So at 40 years of age, you will start doing your mammography, and you will repeat it every 2 to 3 years.
Okay.
So it's not just one mammogram that you have to do at 40 years. You have to repeat that mammogram every 2 to 3 years to monitor the changes that are going on into your breast. So many of the changes in the breast, they are just picked by noticing the changes in different mammograms. So sometimes in our country specifically, it may not be possible for women to do their mammograms like every 2 to 3 years, but they should understand that screening mammography is not one time test. It should be regularly done.
That is a very important point.